Good afternoon, good evening, good morning. It's so great that you could join us today for our webinar, an hour-long webinar called Internship Preparation and Training Amidst COVID-19. This is part of our Staying on Track webinar series. Before we begin, I just want to cover some basics with you. All participant lines will be muted for the duration of the call. If you experience any issues with audio or video, make sure that you've shut down other applications that could be running in the background. If the problem persists, I suggest simply exiting the webinar and then rejoining using the invitation link that you received. There's also a call-in option for people that are having trouble, like me today, with their audio on their computer. So this webinar is being recorded, and all registrants and attendees will receive a link to both the slides and the recording by tomorrow. You can also download the slides from our Staying on Track page, which I'll go over in just a second. You'll receive a survey at the end of this webinar, and it's through previous attendees' feedback that have helped shape the course of future webinars. So I appreciate any feedback that you can provide. APA has a plethora of resources available to help people at all levels of their training and all sectors of psychology and the public. Go to apa.org and you'll probably see a banner at the top of every APA page directing you back to this resource page. Otherwise, go to apa.org/topics/COVID-19. There's a special section for students and trainees in the education, training, and distance learning link on the right. I hope you find that useful. We're trying to update that daily, pretty much 7 days a week. And then I wanted to let you know specifically for students and postdocs, we have a blog called gradpsychblog.org. And if you go there, you'll see pinned at the top of gradpsychblog.org is our latest information for students. And this is where we're telling you all about the upcoming webinars, linking to a Facebook group that APAGS is organizing for graduate students. Plenty of opportunities to plug into the conversation and find resources that might not be featured elsewhere. I encourage you to check that out. You can subscribe to the blog as well for updates. As I mentioned, this is part of our Staying on Track during a pandemic webinar series. We've actually got two webinars today, this one and then one in 4 hours from now, specifically for people applying to postdocs, people in postdocs, and people planning to get licensed. You can find upcoming webinars as well as recordings from previous ones on this page, pages.apa.org/staying-on-track. Hope you find that to be a really good resource. And I also want to highlight one additional webinar coming up, and that's on the next slide. Our APA president and CEO have been running a weekly series on Wednesdays. And next Wednesday, there's a special town hall for students. Our own APAG chair will be a co-host along with the Chief Education Officer for APA. So you can see the link on your screen as well to find out how to register for that webinar. All right, well, I think we're ready to get down to what you're all here for. And just to remind you that this turnout is really indicative. 635 of you are logged in right now. It's really indicative of how important internship and completion of your training and graduating on time is. And we're really glad that we can have our presenters be a part of narrating what's happening on the ground and how both APIC and the APA Commission on Accreditation are advising training programs and students. So we've got 3 interns lined up to document and provide witness to their experiences. Kiet Hun, who is an intern at the UC Berkeley Counseling and Psychological Services. Madeline Brodt, she's coming to us from Washington State, an intern at the American Lake Veterans Administration. Taimi Kasso is an intern in Manhattan at the Manhattan Psychiatric Center. After you'll hear from our 3 interns, we'll turn it to Matt Zimmerman. He is a board member of APIC, and he's also a training director at the University of Virginia and their counseling center. And then finally, you'll get to hear from Cindy Juntunen. She is the chair of the APA Commission on Accreditation. I didn't get to introduce myself yet too, so I'll just tell you this is Eddie Amin. I am the Associate Executive Director of Early Career and Graduate Student Affairs at APA. So I get to work really closely with graduate students and early career psychologists. At this point, I wanted to just give some feedback to you. I asked you during registration when your internship did or will start. So we've got a number of people that are about to start internship in 2020. That's 28% of you. 5% of you are tuning in because you're currently on internship, and a good chunk of you are planning to pursue internship next year. So I give you applause for joining in no matter what stage. We believe that we'll have information relevant to all of you today. And then on the next slide, we asked a more poignant question. How concerned are you about COVID-19 impacting your timeline to graduate? Just over 2/3 of you have some degree of concern, slightly concerned, followed by somewhat concerned, and then very concerned. I want to hear more from you that are not at all concerned. I'm sure that your training directors and faculty are doing something right, and I hope that all of you may have a slightly decreased sense of concern about your timetable. Something that I think you'll hear echoed, especially by Matt and by Cindy in today's presentation, is that many members of training councils and across APA and other stakeholders have used this word flexibility. And I'm pretty sure I've heard from every key stakeholder that they do not want to see any trainee or intern lose a year or see their timeline delayed. So I want to let you now hear how that plays out. So without further ado, we'll turn to our intern panel. We'll all go off webcam except for Kiet, and he's going to talk about his experiences interning at a university counseling center. Good luck, Kiet.
Thank you, Eddie. I'm happy to be here with you all and to speak of my experience during this transition period of COVID-19. So as Eddie was saying, my name is Kiet. I'm a doctoral intern at the UC Berkeley Counseling Center. And so I'll just highlight some of my experience today with the transition that has occurred over the last 8 weeks, some of the challenges I've encountered, actually some surprising benefits, and go into some troubling issues around xenophobia and racism that's happened amidst the pandemic. So during the transition period, I would say during the first 3 weeks, there was a scramble because we didn't have the infrastructure at my counseling center to do all remote sessions. And we were trying to consider safety for everybody as well, especially people who are immunocompromised. And so our counseling center at UC Berkeley is situated within the health center. So our primary care and urgent care are there as well. And we all work in collaboration. We consult and see students in each other's offices all the time. And so at this point, since the risk level was so high for the counseling center, we transitioned to a skeleton crew, which meant that only a small number of staff would be on site. And interns were not included at the staff, so interns were all transitioned to working from home. And we had to get laptops, get remote access to everybody to access the charts. So it was a period of disruption to services where we were, I would say, 3 weeks where we weren't seeing students on a regular basis like we were, because we had to have our schedules open in case there were emergency situations that we need to attend to. We were still taking intakes though. And at that point, we were transitioning to Zoom and phone, and there were a lot of considerations that the leadership team had to think about to do that. There's a lot of legal issues around HIPAA compliance, technology, how to deal with students who were out of state, so state by state licensing laws. But after that, I think it became a little bit more smooth after that was ironed out. So all trainings and meetings were transitioned to Zoom as well. So at this point, maybe 3 or 4 weeks in, I was working from home like all the other interns and most of the staff. And we were just on our laptops the whole time, basically to do sessions and meetings. And there were some people who had COVID-related issues like death in the family, childcare issues. So the university as a whole offered 2 weeks time off for people who had those issues to attend to those issues. So we didn't have to use any vacation or sick time for that. There were a lot of difficulties along the way, I would say. Hours, getting direct service hours is an issue. I was reading the questions that Eddie sent from participants, and a lot of people had questions about hours. For me, my total hours are going to remain the same, which is about 2,000 hours for the full year. But direct service hours are lessened because there was a disruption in services, and some students decided not to continue to have individual group therapy because they didn't like the Zoom or phone platforms. But as far as I can tell, the total hours is what matters for me graduating, finishing the internship site, and also for a license in California. There's definitely impacted the students' experience of the service. Like I was saying, some students decide not to continue treatment. It was harder to build rapport with some students, especially new students coming in. It's more difficult doing intake with new students over Zoom, especially over the phone, because you don't get a lot of nonverbal communication, which is what you need, which is what a lot of what I need for establishing good rapport. And a lot of students, or some students, were returning to non-affirming environments when they were going back home with the families to shelter. So I noticed this especially with trans and queer students that I was working with. There was impact on staff as well. Zoom fatigue, being on the computer all day made my eyes tired, made me really fatigued. I felt isolated from the rest of the team. Usually after a difficult session, I would go and consult with other people on staff, so I don't have that same type of collaborative support anymore. Although we have a system where we could contact the front desk if we need to consult, and they find out whoever is available. They let us know, and they let us know to contact that person by phone or by Zoom. All right, and I talked about the issues about providing services to students across state lines. I noticed there were some disparities that were coming up as far as access to telehealth, so for staff and for students. And so there were difficulties around not having private space at home. This is the Bay Area where a lot of people share rooms with 1 or 2 other people because of the costs. And so for some staff, it's hard to find, especially student staff, like interns like myself, where we didn't have private space to have sessions at home. So we had to get creative or figure out ways to have the privacy to have sessions at home. There were some surprising benefits that I noticed from working from home and working remotely as well. Some students find that it was easier to seek treatments from us by not going to a counseling center. That's because as you go to counseling center, people are of course afraid of the stigma of receiving therapy, and so this is easier and more accessible for some people because they didn't have to get out of the house. There were some opportunities to attend to the cultural issues. I joined a work group where we're looking at cultural considerations for telehealth. And so we're trying to attend to how to make this service more accessible to students, especially those who don't have the private space or who don't have computers that are powerful enough to run Zoom for video sessions, or those who don't have fast enough internet service. Of course, I like not commuting to work. I appreciate not being afraid of virus exposure from working from home. It's a less stressful environment here than at the health center where there's people running around all the time because of all the medical issues that we have going on. So I mentioned there were some issues around xenophobia and racism that emerged from the virus. So we hear in the media about people calling the virus the Chinese virus or the Wuhan virus. And as a result, that's really stigmatized Chinese Americans and even Asian Pacific Islanders in general, because the discrimination kind of gets generalized to anyone who presents as Asian. And so I was hearing a lot of reports of people who were being verbally or physically assaulted on public transit, businesses, Asian-owned businesses losing business because people were afraid of their safety because they assumed that Asian people were more likely to have the virus. So a lot of local Chinatowns were affected as well. And so, this is an issue that was affecting me. And so I just made it a point to bring it up to a lot of my API students to see how this has impacted them, how they're dealing with it, and just talking about the impact of discrimination and what kind of effect that has on your mental health, and talking about how to receive support, how to deal with the discrimination, and when to deal with it and when not to deal with it. That is, you have to gauge your safety, whether it's worth the energy to engage, how you might feel if you don't engage. That's the piece about the regret of inaction. And I've done some panels where I talked to bystanders about how they could intervene as well to help with the API allies, students and friends and family. And I believe my time's up. So I know that was just a quick highlight of some of my experience. So I'm happy to answer questions, any specific questions about any of those experiences.
So Madeline Brote, as I mentioned, she's interning at the American Lake VA in Washington State. We got up very early to prepare for this, and really interested to hear how your experiences have changed, and also how your clinical approach may have to be modified during this process. So without further awkward ado, I'm going to give it to you now.
Good morning, everybody. Eddie's shared that I'm in Washington. So I've been dealing with coronavirus since February, because since we were the fun ground zero of this. So to put it in perspective, the first reported case of someone dying from COVID happened in late February. And so this was an issue for me and my fellow interns pretty early compared to other folks. Unfortunately, that early kind of knowledge about coronavirus did not speed up kind of the way that my internship handled it. I was exposed to COVID during 2 conferences that I attended at the beginning of March. I actually packed extra stuff with me for those conferences, expecting to get stranded somewhere because of COVID. Eventually, I consulted, once I came home, I started to develop some symptoms that are consistent with COVID, and occupational health told me to go ahead and head home so that I can not risk infecting others. What ended up happening is that I developed an illness that is remarkably significant to COVID, but I tested negative. And I ended up having 2 weeks of leave without pay because I ran out of sick leave. I know I'm not the only person who had this kind of experience of not having income while they were dealing with some of this stuff, but I wanted to highlight that because I think that is one of the unintentional kind of impacts that interns experience. After I returned to work, I was expected to return to campus, and I spent 11 days on the VA campus. I started working from home for the first time on April 10th. So there was quite a significant amount of lag time between when I had hoped I could start working from home and when I actually started working from home. Those concerns, I engaged in a lot of advocacy, modeling after my next speaker. And the other New York City interns about how we can move this process along. One of the unique challenges is just kind of engaging in that advocacy within a VA system, which I'd be happy to talk about further if folks are interested. But aside from my personal experience, I'm still working from home. I'm really grateful that I get that opportunity. It does take a lot of stress off my plate. What my current rotation is the primary care mental health integration rotation. And so what that means is that I'm kind of, seeing people who have never engaged in mental health services before, or people who had subclinical symptoms, but have been coming to the VA because those symptoms have increased dramatically because of COVID. I specialize in multicultural issues and trauma, so I've been taking a lot of the cases for folks who have experienced traumatic events, but haven't gotten treatment before. So there's been lots of people who have just straight up increased trauma symptoms, which makes sense, right? We're all kind of feeling this moment as a very stressful moment, and some folks have suggested that it can operate as a small t trauma for all of us. But what happens is when you're concerned about your life and the life of others, if this echoes back to prior experiences you've had because of trauma, it's really difficult to kind of cope with the additional stress. So the things that I've been working on with veterans, I wanted to kind of share with other folks because I think it's been challenging even for me to kind of adapt to this kind of way of working. So many people who experience trauma have developed really negative beliefs about the world. And a lot of the discourses happening around the pandemic can only serve to reinforce some of those. So, what I've done with some of my veterans is specifically focus on positive examples of the ways that human beings are actively disproving their trauma cognitions. So, for example, a veteran could say something like, there's no good left with, nobody is helping each other anymore. And on the Division 17 listserv, there's a person who's compiling positive events, and I've actively shared some of those with my veterans so they can know that other people are taking care of some of these concerns, and we're working all together to maintain this. I also engage in some pretty significant kind of psychoeducation about how trauma and this experience of the pandemic can be related to normalize some of their experiences, and really encouraging them to have a more present focus in their skills. This doesn't seem super radical in terms of trauma work, and I know there's people here who are familiar with that work as well. But what has happened is that it actually is taking a little bit longer for veterans to digest this information and actively be able to put these skills into use. Even though they're in higher need, it's just harder to intake some of this kind of difficult cognitive information. The other thing is that I've been really focusing on grounding skills with veterans because so many of them have really been having a lot of difficulty keeping themselves in the present moment. A not uncommon experience for folks who've experienced trauma. But we've had to alter that somewhat so that it's safe and consistent with CDC guidelines. So for example, in the past, I might have encouraged a veteran to go take a walk or go to nature, especially since so many people here in Washington are really tied to outdoor experiences. Those aren't available right now. So what we've been doing is the work that I've been doing with veterans is really trying to collaboratively identify grounding skills that tap into those really helpful supports, but don't put them at risk. So I've done a variety of mountain forest meditations. So they imagine themselves walking up Mount Rainier and going on one of those paths, or they're thinking about ways that they can tactilely ground themselves that doesn't put themselves at risk. So for example, I've been using the DBT classic of frozen oranges a lot because those are relatively safe. But really for me, it's been helpful and also for me personally and for me professionally to think about this as an ongoing conversation about how trauma can predispose people to have more difficulties coping with stress, and that we need to understand that when we're clinically working with them. So that's just a little bit of a sample of what I've been trying to do, but I'm happy to talk about it more if folks have more questions about it.
Thank you, Madeline. That was really rich, and I appreciate your sensitivity to your population as well as to the moment in time that you're in. I want our listeners to hear next from our third three interns joining us today. Again, this is Taimi Caso from New York, and has had quite an interesting experience. I won't do anything but let you give it away. So thanks again for joining us.
Thanks, Eddie. Thank you all for joining us this afternoon to hear about our stories during this crazy time. I think I want to start by just sharing a little bit about what life has been like here in New York during COVID, and I want to focus on how I had to navigate some systemic and institutional barriers I faced along the way. So a little bit about me. I'm a fifth-year doc student in the counseling psych program at NYU. Those two lovely beings are my dogs, Chuchi and Chachi, and on the right is Washington Square Park, a place that I frequented a lot when I was on campus. And the bottom two images are a sobriety meditation garden at Bellevue and rec area for inpatients, which was on the 20th floor, or 22nd floor, I should say. That's where I came from before going to Manhattan Psychiatric. So I began internship at Manhattan Psychiatric Center. It's an OMH New York State inpatient facility. It's located on Ward's Island, which is a very small island to the east of Harlem. And I started there in September of last year, so a little late. The pictures that you're seeing are the front entrance of what this hospital looks like right now. There are 3 layers of barbed wire, fencing, and a cage that you have to go through in order to get access in and out every day. Most of the frontline direct service staff are people of color, and the administration is primarily white, which is notable in an area that is right off of Harlem. The patients we serve suffer from severe and persistent mental illness. I've worked with sex offenders in a sex offender treatment program, and some of them are geriatric patients with comorbid psychiatric illness and medical illnesses. So our work as interns here really consists of inpatient groups, an outpatient group at a shelter on the grounds, as well as individual psychotherapy and assessment. I would be remiss if I didn't say that internship here presented a lot of challenges around safety, competency, ethics, and cultural responsiveness, which were really magnified when COVID began to sort of impact New York City. So just to give some context, we're on a small island again on the east of Harlem, in a hospital that's next to a waste treatment plant, and we're in the heart of the pandemic. When the number of positive cases began to increase exponentially in the city and local hospitals were feeling burdened, the psychiatric hospitals really started to feel the shocks of it. This is an image of tents and trailers that the Army Corps of Engineers put up on the island to strategize and create more infrastructure. So what issues did I face? As a state employee and like other employees, staff were asked to meet with patients directly, to continue individual psychotherapy and groups without any protective gear, without any proper social distancing guidelines, through about mid-March. That went on for a few weeks. Once social distancing guidelines were implemented, we were asked to remain somewhat at a distance from patients, but as you can imagine on an inpatient site, it's really hard to do that when patients are confined to wards. And you share many small spaces like elevators and hallways. Most of us ride a hospital shuttle, so even if we were social distancing on site, we were right next to each other, crammed in a van that would take us from the island to Harlem and back. And on top of that, our hospital continued to accept admissions from hospitals that were overrun with COVID, including places like Creedmoor, without testing patients because either the testing wasn't available or it just wasn't prioritized at the time. So being there was really being told metaphors that we were soldiers on the front lines, that we needed to battle this head on, and to show up for the hospital, OMH, and our patients. These messages were communicated without really any significant reflection on the parallels between being mandated as essential and colonial attitudes towards marginalized communities of color. And as a student of color, this was on my mind. Some of the messages were really infantilizing, and many of us risked our health and our roommates and that of our partners and people that we lived with in order to receive a minimum wage salary, which was exploitative to begin with. And I think most interns can acknowledge that. The power differential was blatantly obvious for us. The institution, the training director, all had power, and the interns are still dependent on these evaluations, on the determination that we successfully completed internship, all those things in order to continue on with our lives. And I couldn't help but think that their licenses weren't on the line, but our futures were. So during this time, I remember receiving a lot of communications, written and otherwise, stating that if I didn't come in, I wouldn't be paid. And if I wasn't paid, I would be removed from payroll, effectively fired. I was repeatedly informed that working remotely wasn't possible, and hearing this was really difficult because it was possible for other staffers within the OMH system. So I felt exploited as a person of color, and that experience was really devastating. I perceived this indifference as reenacting a lot of the hazing that happens in our field. So this raised a lot of ethical issues for me. I mean, I worked in a system that often misrepresented the amount of infected patients by under-testing and under-reporting, withholding information, and ultimately keeping us blind to the realities we were facing. I asked myself, is it ethical for a trainee to be mandated as essential? Given that we're not compensated equally, we don't have the same protections, and we don't have the same resources to buffer us if we do get sick. Is it ethical for me to provide services to a population that doesn't want services or that fears that I may get them sick and therefore is refusing services? I asked myself, why is the hospital admitting new patients who haven't been tested? And why did human resources require a COVID-19 positive test result in order to give employees paid time off? Do we even have rights as employees? Do we have rights as trainees? And who looks out for trainees given the financial conflicts of interest between organizations like APA, APIC, and membership sites that pay dues? So these thoughts were shared with hospital and staff administration, and unsurprisingly, the metaphors kept coming. I worried that I wouldn't be able to finish internship or accrue enough hours to graduate, the expected amount being 2,000. I worried that I'd lose my dream postdoc and that I would get sick and by extension, my roommate's sick. So I worried I'd lose 2 years of my life if this didn't work out, or that I'd have to quit my program altogether. And I had worked so hard up until this point, as a queer Latinx woman of color, how could I possibly not finish, after all that sacrifice? And a lot of staffers felt very similarly. What you're seeing on this screen is newspaper articles highlighting Manhattan Psychiatric for different issues like staff deaths, risk that people were perceiving they were exposed to, and OMH's response to COVID-19. So as things intensified, I had to advocate pretty strongly. I spent hours drafting letters, figuring out the complaint process through APIC, speaking to COA. The responses I received in many ways reflected that we're all in this together and that there wasn't much that could be done. I recall one email I got from a director of one of these organizations, and his response was clear. The choice was mine. Either continue reporting to internship if the site refuses to offer telehealth, or request a match release, which to me didn't feel like much of a choice. The people in positions of power within these systems kept a solid, unified message, and that message often did not reflect the experiences of a brown trainee, much less a queer one. I kept pushing and sort of getting these tone-deaf responses, and eventually I was able to collaborate with other interns, and we really found a way to advocate for ourselves, both in meetings with our administrators and with our programs. I was fortunate enough, and this is a shout out, to have a DCT and a director of clinical training at NYU that really had my back in this process. We submitted informal complaints, we submitted an ASARC, and it was really hard balancing all of that while managing, being in this pandemic and keeping myself mentally well, as well as continuing to show up in person. So not only was that going on, but I was in the middle of dissertating and serving in other leadership roles, and I honestly was not the only person that needed help. So being an intern during a pandemic was never really what I had in mind, and much less dissertating during this time. It all felt like much more than what I could have ever imagined and planned for. But one thing that stayed in my mind was I really couldn't let my ancestors down. So I worked diligently, and I collaborated with other people whose reach was a lot farther than mine to release statements from different orgs, including NLPA, to support students. And in these dark times, I found great kindness and solidarity in others. And as of today, I'm still on internship. I'm working from home. I submitted a full draft of my dissertation on Monday, and my oral defense is scheduled. So you get through it. It's really hard. You're gonna have to ruffle some feathers. I don't see a way around that, but I know that my ancestors are smiling down on me.
Wow, Taimi, thank you very much for documenting your experiences. I want to thank our three interns for really providing us an incredible archive of how your situations have changed, how you've risen to the challenge of continuing to provide patient care, but also taking care of yourself and your cohorts and your families during this process. Really grateful to have that testimony. I now want to introduce Matt Zimmerman. Matt is our Director of Clinical Training at the UVA Counseling Center, as well as a board member of APIC. Many of you are familiar with APIC as an acronym. It's the the Association of Psychology Postdoctoral and Internship Centers. It helps coordinate the match. It's the place where you go to find what internships are available. So Matt is going to provide his take on how APIC has responded, and also probably address some of the concerns that I see popping up in the question tab from incoming and prospective applicants. Matt, thanks for being with us today.
Sure thing. And I just want to start by saying to Taimi, I think you've been through a horrible experience, and I know some others have as well. And I'm really glad to hear that you made use of the IPC, the informal complaint system, and the ASARC, which is the formal complaint system in APIC. We stand with you in appreciating the power differentials, and it's not the same for staff as it is for interns. So thank you for speaking so clearly about your experience. Okay, let's jump in. Next slide. So first and foremost, this is an unprecedented time. We've never seen anything like this. And we're all trying to figure it out together because the last pandemic was over 100 years ago. Training things like this weren't even in place then. And nobody really knew what to do at first. And we very quickly had to figure it out. And keep in mind that interns and incoming interns are one down. They don't have stable employment for next year. Things are much more uncertain, and it is more difficult to advocate for oneself in that circumstance. The first thing I think I would want to say is it's really important from the APIC perspective to balance the requirements of the internship with staying safe. And the CCTC, and I'll explain what the CCTC is. The CCTC is the Council of Chairs of Training Councils. Yes, it's 4 words and 2 of them are council, but what it is it's the representatives from 15 of the training councils, and they meet twice a year and they come together when crises are happening or when initiatives are happening. And they created this statement, and this is a live link so you can refer to it. And it lists these core principles that should really be guiding training directors and sites in regard to support of interns and postdocs. So feel free to refer to that document, but first and foremost, balance of work and the many new needs that have cropped up since this all started, continuing to be developmentally focused, really like Eddie said at the beginning of this, really approaching trainees with as much flexibility as possible. And certainly sites and systems have lots of different structures, lots of different barriers, lots of different HR systems, but really trainers are really encouraging as much flexibility as possible to help get interns and postdocs across the finish line in a way that's gonna help the trainee certify and be ready for licensure down the road. And then of course, you know, being socially responsive, particularly to vulnerable trainees, those who may have a health issue, those who may be enduring a financial crisis, those who have left space to negotiate. The many ways in which we need to think about who are the more vulnerable trainees at this socially distancing time. That same statement made some strong recommendations, limiting in-person contact, really adjusting educational and licensing requirements. So the standards would remain the same, but within those standards, having there be flexibility in regard to the educational and licensing requirements. And you'll hear Dr. Juntunen talk about that more as well. Doing whatever we can as training directors to minimize the adverse impact on trainees, whether that is because of the social distancing, whether that's because of the work responsibilities, whether it's related to finances. And APIC is aware of the many concerns that you're hearing today. And getting in touch with programs and advocating. Pursuing access to training beyond distance education if possible. Doing whatever we can to minimize resource disparities. And then consultation. APIC's always available for informal consultation. And of course, there's the formal complaint process as well. So it's definitely a time for training administrators, along with trainees, to think together about thinking outside the box. These are just some of the ideas that I have heard and that we're utilizing at the University of Virginia's Counseling Center, because there's the total hours issue and then there's the direct hours issue. And in terms of total hours, there's lots of ways to think outside the box, whether it's virtual projects, planning projects for consequent years that future interns or postdocs might actually complete, non-clinical services that are of value to the agency, online and virtual interventions. A lot of our trainees are getting more involved with Instagram, Facebook projects to reach out to students. Collaborative discussions with training administrators about how this may be an opportunity to explore virtual methods for intern selection, training, interviewing. It's a really good time for thought work, and all of that counts as direct hours. I'm sorry, all of that counts as total hours. So what counts? We know, and I certainly know from my home institution at UVA, we know there's a lot of stress about hours. And in all of our conversations at every level, from the Department of Education to the to APA's accrediting body, which you'll hear more about, to the sites, it's all about flexibility right now. But as some reminders, teletherapy counts, whether it's video or phone, it counts. And we adjusted that to the API a few weeks ago for those who are incoming interns. And just a reminder, any training activity related to program goals and competency counts. In my experience, trainees are often undercounting when it comes to total hours. And of course, need to consider direct and total hours. You know, our sense is that the direct hours is more challenging. For many sites, there was this gap of anywhere from 1 to 3 to 4 weeks where teletherapy hadn't gotten ramped up yet. So we're playing a little bit of catch up with direct hours. So to be clear about this, when it comes to internship completion, that's up to your program. So your training director or training committee, based on evals, determines certification of your internship. That's based on program requirements, APIC membership criteria, the accreditation requirements, and prepping trainees for licensure. Now, for state licensing boards, the requirement is there to protect the public. It's your training director who will complete the verification of your internship or postdoc hours, and that'll get submitted to the state board for licensure. So flexibility, again, is the word of the day. In regard to incoming interns, what to track. So APA, CPA, and APIC have all encouraged flexibility, and at the same time, training competencies will continue. Programs have been asked to develop disruption contingencies in terms of startup and orientation, in terms of what the early internship will look like. Most importantly, though, for incoming interns is communicate, communicate, communicate. Your training directors might not be clear yet on what your institution's HR requirements will be in terms of whether or not your site will be open or entirely virtual or some sort of hybrid. So more than previous years, it's really essential that incoming interns stay in continual communication with your training directors, and training directors are being encouraged to do the same. Resources, I put all of these here so that you'll have them. These are all amazing resources. APAGS, like Eddie was saying, has lots of COVID information. There's the link to the APIC informal problem consultation that Tammy made reference to. There's the APIC FAQ for COVID, the joint statement, and then APA also has lots of COVID information on their site. Prospective interns, this is being discussed every day in every training community. We really don't know what this looks like yet, generally or by site, because really the focus has been on figuring out what to do with current interns first and foremost, then figuring out what to do with incoming interns, which is being talked about a lot, and then to figure out what's going to go happen with prospective interns with interviewing. But again, most importantly, stay connected with APAGS, stay connected with APIC through the information on our website, and stay connected with the sites that you're interested in applying to.
Thank you very much again, Matt Zimmerman. And we will now turn to Cindy Juntunen. As I mentioned, Cindy is chair of the APA Commission on Accreditation. COA is its acronym, also is at the University of North Dakota as a dean. Very grateful that you could join us as well.
Just to kind of provide a little bit of context at the very beginning, it's important to note that a lot of the things that the decisions that the Commission will be making related to COVID are influenced very much by the fact that the Commission itself is recognized by two regulatory bodies, the Department of Education and the Council on Higher Education Accreditation. So we actually have to follow those guidelines. In a sense, we are accredited by them the same way that we accredit programs. Fortunately, both of these entities are supporting flexibility, as is our other groups, as Matt has talked about. And I also think it's really important to keep in mind that COA regulates programs, not individuals. So we can't always speak to specific student or trainee issues, but we address the concerns programs present to us. And very quickly, many of the things I'll be talking about will refer to the PWCs, the profession-wide competencies, which all of you on internship are very familiar with these. But just as a quick reminder, the PWCs are the primary training components that the COA expects programs will be able to both provide training in, and importantly for the next part of our conversation, be able to document and that interns have demonstrated the competency in each of these areas necessary to be ready for practice. And that's important because of the primary things that we consider when programs present issues to us. So now what we're finding, not surprisingly in this time of COVID, is that lots of programs are contacting us with very specific questions about what kind of options they have in terms of modifications to their training, but also ensuring that the training program is able to remain accredited. And so I've kind of broken up the three basic categories of what I would call essential considerations that the Commission is making. First, in terms of the PWCs, the profession-wide competencies, many programs are asking about alternative training activities. So for example, if the number of client contact hours is down, what else can be provided instead? And the basic question that we ask programs to consider then is, how are these training activities contributing to mastering the PWCs? As long as the program is able to demonstrate that training activities are related to the PWCs and that they're still able to evaluate competency in those areas, that's a really important consideration for us. The second really important thing is that supervision remains constant. That supervision is, of course, a hallmark of the internship experience. So are supervisors still available? Is the minimum supervision required, which is 2 hours of individual and 4 hours total? Is the minimum weekly supervision still available? And can direct observation occur? And of course, direct observation can be either visual or audio. There are lots of ways in which that can happen. And then the final kind of category of considerations we have is, are these changes that are being considered just current temporary circumstances? Are they changes that are going to be, this is what we're going to have to do until whatever future date when situations change? Or are some of the changes that programs are considering going to result in a permanent alteration or training of quality? Those are the kinds of factors that we consider when we respond to programmatic queries. And so here are some specific examples, and I think this might be relevant to a number of you. So very quickly, the Commission has identified that, of course, telehealth and telesupervision are permissible, and they are permissible at any time in the standards. Remote didactics are also permissible. Direct observation is an important part of training, but both video and audio are allowable. We've had a number of programs contact us about an incomplete training year. What happens if we can't actually get to the end of the training year? And if it's possible to make that up, that might be great. But if it's not possible, have they been able to demonstrate that each intern had the opportunity to demonstrate the minimum level of achievement in the PWCs? So, for example, how do they know and can they document that interns are ready for practice? This becomes an important factor and a case-by-case kind of response for us. And then what kind of alternative training, Matt, Dr. Zimmerman mentioned this already, alternative training activities, again, indirect methods can be really useful, and they can also address the PWCs and be very relevant components of training. There are a few things that COA does not address. It's outside our purview. The number of hours, which has already been talked about, we don't specify a minimum, and so that really is more of a licensure issue. The question of whether interns should be identified as essential staff, we really see that as being beyond our scope. That's very much based in the institution. And then, of course, we don't address issues emerging at non-accredited internship. We can speak only to programs that are accredited. And finally, I just want to say that, on COA, we acknowledge this is a very fluid situation. We are continuing to respond to unique program situations on a case-by-case basis, and I expect that that will continue. And our basic guiding principles are in what ways are the welfare of trainees being protected, and in what ways are the welfare of the public being protected. And as we make decisions and updates, we post them on our COA COVID-19 page, and the link to that is right here.
Thank you so much for your presentation, and I'm impressed you were able to get through all of that so efficiently. I'm again grateful to the 5 folks that we've been able to pull together from different corners of this country. I'm grateful to be interacting behind the scenes with many folks that are asking questions during this presentation. And I think we're now going to take some time for those very questions. I invite our panelists, if they're able to come back on webcam. And let's see, as I've been sorting these questions, it did strike me that it was necessary to remind people again about that 4 o'clock webinar. We'll have an individual from the umbrella group for state and provincial psychology boards, licensing jurisdiction, and Dr. Alex Siegel will provide an update there about how licensing boards are thinking about the question of hours. So I want to turn first to questions about incoming applicants. Is there a likelihood that internship interviews will move virtually? Is there being any advice provided either by COA or APIC to move in that direction? And without a crystal ball, do you have any sense of what the internship selection process might look like for the 2021 match day?
Sure, I'll field that one. There is much discussion occurring in that area, and I can't say what the likelihood is that there would be a recommendation that all programs move to virtual interviews, but that is part of the conversation that's happening. Would APIC, for example, make a recommendation that all APIC members are expected to do virtual interviews? That conversation is happening, and I don't have a more clear answer yet.
Thank you. Along those lines, what concessions do you predict sites might make for people that have reduced hours? So I guess, are you hearing anything about sites being flexible with those hours? You may have spoken to this already. And then do you anticipate any across the board level setting in terms of policy about hours that should be acquired by the time someone applies to or finishes internship?
Sure, I don't think there's sort of a blanket recommendation there about what sites should do in terms of their hours requirements for application. But I would say we've never seen something national like this happen. So for the most part, we're expecting everyone's hours to be somewhat depleted because there's been more challenges at the practicum level than there has been at the internship level with transitioning to teleservices. So I think it is generally understood in the community that will be reviewing applications that hours are going to be generally lower.
Thank you. I'm mindful of the time, and I would invite everyone to look at their watches. I can take a few more questions if some of our panelists have to go. I completely respect your busy schedules as well. For those that are dropping off, be on the lookout for look to your inbox for slides recording, and certainly we invite continued dialogue. If I can't answer your question, I know one of these 5 folks can, or we can help continue to identify resources to get you the answers you need. This question came up, Taimi, during your presentation. But I would open it up to anyone. Is there any advice that you can speak to about how to advocate for yourself, understanding the positionality that you have? The more you're likely to speak out when you don't have the same I guess, employment guarantees as others?
Sure. I don't have an easy answer for this. People who know me know that I just show up like myself and I try to say what I'm thinking in a very professional way. So it took a lot of courage. I think it takes us really stepping into that professional role and realizing if you're this far in internship, you're almost there, you're at the finish line. And how would you navigate this in a year? How would you navigate this 5 months from now when you are a staff member? For example, in OMH, you can be a staff member without a license and get hired on to do associate psychology work, as if you were a psychologist. So really, I think it's speaking truth to power and acknowledging that power won't like that and they won't like what you have to say, because it's challenging. I also think that being a younger clinician and speaking up when other folks, and there's a huge age differential and people have been in the system for 10 years, really, or 20 years, is challenging. But I think solidarity is important. So more voices are better than one. So whenever we had something to say, my cohort of interns and I would band together, and that meant sending really annoying emails with everybody CC'd on them. So we would all send it. I remember when we were really, really struggling through one of our challenges, everybody synchronously sent an email, like back to back. So I sent one, the next person did, and all four of us did. And I know that upset some people, but it made our point clear that we stood together even when the system didn't stand for us. So I think relying on other people and working together and stepping up in terms of your own agency is important.
I agree 100% with everything that you shared. I think in our process, it was really helpful to identify staff members who were in agreement with us, but didn't necessarily feel empowered to vocally support us and were able to provide us with some feedback on planned actions or planned communications. I found that to be really helpful. And I just want to echo Taimi's kind of voice about like, you are almost done. And a helpful reminder of that is really great. If in 2 months you're going to be an official psychologist, remind the people that you're working with of that, because I think sometimes there's an automatic association between trainee and young and not well advised. But we have been mentored and learned from so many people over the course of our career. By the time we get to internship, that our experiences and advocacy is just as powerful as someone who's fully completed their doctorate.
I would just like to add that it's also important to develop allies at your site as well. So people who are, I mean, it could be your supervisor ideally, since you're meeting with that person, you already have a close relationship, but it could be anyone else on staff as well. Just so they could speak up for you during the senior staff meeting or the leadership meeting where you're not there. And so they could be like, wait, let's think about the interns in this situation. Let's think about their needs and the idea that they have less power than us, that they don't have a voice here. So I think it's really important to identify those staff members and really develop a relationship with them, especially staff members who share some of your marginalized identities too. You have those, because then they're more conscious or aware of those power issues because they share some of those experiences.
Thank you so much for answering that. I think given our time, I'll just close this out. There's a number of questions that came through, especially even today during our live webinar on counting direct hours. Dr. Jensen, and you had mentioned profession-wide competency. Somebody asked, as long as I'm doing something related to a PWC or profession-wide competency, is that a direct contact hour? I know that a number of you spoke about it, and I wonder if you could maybe share a little bit more for people wondering what might be direct service hours in this time of pandemic.
Well, I can speak briefly to it just by, like, direct service hours generally mean that something from that hour impacts the clientele to be served in some way. And I want to be really clear that the commission doesn't have any minimum cutoff expectations. The commission's focus is on, are you competent? Not how many hours have you completed. And I think that that's a really important distinction to be aware of, in terms of there are lots of ways to measure competency that have nothing to do with hours. And so just as a clarification point on that front. So Yeah, so I'll leave it there. And APIC might have more to say about the specific, what is direct and not direct.
I mean, direct is in the service of a client in some way, but that can be broadly defined. And in a lot of ways, it's up to the site and up to the state licensing board, because each state kind of breaks that down differently.
For interns and incoming interns that have not looked up their state licensing board regulations, I encourage you to do that and possibly count that as an indirect service hour. You can be really informative, also really in the weeds to figure out how your state is defining those practical experiences. We are 5 or 6 minutes past the hour, so in order to respect the graciousness of our panelists today and all of you listening in, I will close out. I'll say to be on the lookout for this webinar coming in a recording shortly, as well as a webinar later today meant for postdocs and those seeking licensure. And we'll continue to provide resources. You continue to stay safe and reach out if APA or any of our associated groups can be of support to you. Thanks again and take good care.